Okay, okay, ma'am.
All right. So if you've read and understood, considering it communication skills station, please begin.
Okay. Hello, my name is Dr. Ala Abdullah. I'm one of the surgical team. I hear that you want to speak with one doctor, ma'am.
Yes.
So,
Yes.
could I ask for your name and age, please?
I am Linda. I am the wife of Mr. White.
Nice to meet you, Mr. Linda. So, Mr. Linda, I understand that you wanted to talk with Mr. Man, but
Yes. Where is the Mr. Man? I want him. I want to see him. He said he will meet us together and he will discuss my husband condition.
yes, of course. But unfortunately, now Mr. Man is in theater. He is busy with an urgent emergency surgery. So I'm working with him, and I know information about your husband, so I can talk with you about this. Are you okay with this?
Okay. What do you know his case? Mr. Man know his case. Do you know his case? How you can help us?
Yes, yes, this is important question, Miss. So, Miss, I just want to ask you to know your background about this. What do you know about your husband condition? What happened so far?
Yes, 2 weeks we came to the emergency and they take some sample from his tummy and they say it is a malignant cell. And after that, Mr. Man said he want to do CT scan for my husband. And now they said the Mr. Man is not here. I don't know what we can do. I don't know what we can do with this situation.
Okay, okay. Oh, I'm so sorry, ma'am. I believe that this is an overwhelming situation, and I think it is more normal to be confused in this situation. So, just let me explain what happened so far. Your
Okay.
husband has come to the hospital with a referral from his GP. We did take a sample from the fluid in his tummy, and unfortunately, this sample has shown that there are tumor cells in his tummy.
Mm-hmm.
And until now, we don't know what the sort of these tumors, and we don't know what type of cancer of tumor is this. So we need to do further investigations. In this case, we need to do a CT scan. And I believe that this was Mr. Man's plan. He wanted to talk
Yes.
with you about it.
Yeah.
But I'm so sorry to tell you that the CT scan is not fixed at the moment in the hospital.
Mm.
It has been the CT scan is not fixed for a week. So we need to do another options for this to investigate further your husband condition.
Mm.
So we did a test called tumor markers and we are waiting for the report for this. And we also want to do another test called ultrasound. It's like the imaging that we do for pregnant ladies.
Mm.
All these tests are needed to know exactly what is the source of this tumor and to what extent it has spread to
Mm.
help us to decide what further step we can do. So are you following me, Miss?
Yes, yes, I am following you. Okay. Okay,
Yes, Miss. So
and is this a small hospital? You cannot bring two CT machine in your hospital?
well, I'm so sorry for that, Miss, but this is abnormal situation, and this has been unexpected. So I don't believe that this will happen again. But until they fix the CT, I think we have to look for other choices, and we can transfer your husband for another hospital until to do the CT scan. I think
Okay, is
if
it
you agree on
okay?
that.
Is it a cancer? Is it cancer?
Well, unfortunately, ma'am, we found the tumor cells in his tummy. So we believe that this is a cancer, but until this moment, we don't have all the details. We need to tell you exactly what is this and what will be our next step. So until
Okay.
this moment, we are not sure what will be our next step, and we
Okay.
are afraid. Yes.
Okay, Doctor, why don't you want to go for surgery to remove this cancer from my husband?
Well, thank you for this question, ma'am. But I think to go for surgery, there are some conditions need to be on the table. I mean, we have to decide with the consultant and with the other specialist what will be our next step, and this depends on the extent of cancer. If the cancer has spread to other organs, I think he will not get any benefit from surgery. He even may be at more risk and complication for surgery. So in this case, we need to go for other options of treatment. So do you
Okay.
want me to tell you about this?
No, but I found my husband. He have breathlessness and he is difficult in breathing. Look to him. He cannot take his breath. I don't know why and how can you help us in this? I don't know.
Yes, I understand, ma'am. I understand that. I'm so sorry for that. I think we have some steps, some options that we can do about this. We first can do take some fluids repeatedly from his tummy to help him breathe, and
Yeah.
we also can give him a pain management, painkillers to ease up his pain. I think
Mm-hmm.
this will help him to relieve these symptoms. And
Mm-hmm.
and after the CT and after the tumor marker results, we can decide to do what to do next. There is
Okay.
some options.
Yeah. I want.
Okay.
Do you think his brother is have ischemic heart disease and he lives in USA? Can I tell him about his husband condition, my husband condition, to come and see him?
Well, I believe it's okay for him to come and see him, but I think he has to see his consultant first to know if he able to take this flight. And it's better to wait after we have all the results to give him more information about this.
Okay. Okay. I can tell his family about to see him.
Well, there is no problem with that, ma'am.
Okay.
But until we finish,
Okay. What do you think this fluid come from? What do you think from which organ?
well, at this moment we are not sure yet. But so for that we need to do the CT scan to know exactly what is the source of this. But
Okay.
but unfortunately we believe that this cancer has spread. Okay, because we found the tumor cells in the tummy in the fluid. So it means that the origin of this tumor is another part of the body. So
Mm.
for this case, I think we have less options for treatment, and we might go for radiotherapy or for chemotherapy after talking with my consultant.
Okay. And if we decide to transfer him to other hospital to do the CT, do you think it's safe or dangerous?
Well, that depends on his condition. We will not let him go to another hospital if it's not safe, and we will ensure that he is stable to do that. Otherwise, we will just go with other options of investigations.
Okay. Do you think my husband condition is curable?
Well, ma'am, this depends on the type of cell exactly. Sometimes we found some types of cells that we know how to deal with it, like lymphomas. But in any other case, I think we have less chances of curing or of treatment for this. But this depends on the type of cell, type of tumor.
Okay, thank you.
Thank you, ma'am. Do you have any other question, ma'am?
No, no, no.
Okay, will talk with my consultant and get back to you after the results. Okay?
Okay, okay.
Okay, thank you, ma'am.
Thank you.